Hello, I'm Dr. Brandt Gibson, and today I want to talk to you about DVT, Deep Venous Thrombosis. So a DVT is basically a blood clot in some of the deep vessels of the body. Typically, they're in the legs, but they could be any of the deep vessels. Thrombosis is basically a clotting in that area, of course, or a blood clot, and it can cause pretty significant symptoms. Some of the symptoms that you will see, you may see swelling in the affected leg or extremity. Sometimes it will be both legs, even though the thrombosis is only on one, but most of the time it's going to be just the leg that's affected. You could have pain in the leg or increasing pain. So if you've had surgery or something like that and the pain's increasing, sometimes it's the DVT that's the problem. You could have red or discolored skin on the leg. You could have a feeling of warmth to that area. And the idea, the big risk here is that the clot moves. So you have clot there, and it can actually be really, really painful and should be treated. But if it progresses from there, it can actually become a pulmonary embolism. Pulmonary embolism is the clot going from the deep vein to the lungs, and this can be life-threatening. And in this case, you're going to have shortness of breath, chest pain or discomfort that's getting worse, feeling of lightheaded or dizziness. Pulses are going to speed up. Your breathing is going to speed up, of course, because you can't catch your breath. And you may even, if it gets bad enough, you can even be coughing up blood. So there's a big deal. So if you have a DVT or you think you might have a DVT, you do want to get evaluated. How do you know if this is a risk factor for you? Age. Being older than 60 increases your risk of DVT. Sitting for long periods of time, such as driving or flying. A lot of times people will wear compression stockings to reduce this chance, or they'll get up when they're flying long distances and walk around for a minute. Same thing. Prolonged bed rest, such as after a injury or long hospital stay or paralysis, all those can lead to DVT. That's why surgery is sometimes related, injury or surgery, because you're not using it as much, you're not using that extremity, and you can actually get a DVT. Pregnancy, of course, can cause DVTs because of the pressure that it causes, the retrograde pressure it causes on the vessels. Birth control pills like oral contraceptives or hormone replacement, being overweight or obese, smoking, cancer, heart failure. If your blood's not pumping like it's supposed to, of course, you can clot. Inflammatory bowel disease. If you have a family history or personal history, if you've had previous DVTs, your risk of DVT coming back is pretty high. Genetics. Nowadays, you can, some of the vaccines like the COVID-19 vaccine in rare situations has been shown to cause DVTs as well. So all of these are things you should be looking at. Big risk, of course, is you don't want the DVT to progress. You want to get it controlled early on, and you want to prevent a pulmonary embolism that could ultimately lead to death. So ways to prevent it: compression stockings are very good. Getting up and moving, not sitting still for too long. Eliminating things such as smoking, habits that can actually increase the risk, and exercise, of course, to reduce obesity, and that also increases the functioning of the heart and so forth. So if you think you may have a DVT or you want to be evaluated, then you can actually go to your doctor, be evaluated for that. If you'd like additional information from us, you can actually go to utahfootdoc.com. If you're having difficulty breathing, you're saying, okay, is this what's going on? Go to the emergency room. This is Dr. Brandt Gibson, and this is your Podiatry Tips, Day 390, Deep Venous Thrombosis, or DVT. Thank you for being here, and I'm excited to get an opportunity